Hey everyone, welcome back to They Don't Tell You Neck Pain Edition. So we're going to start off this series just like we do with our other series and let you know kind of why we're talking about this. Neck pain, and specifically chronic neck pain, affects about 20% of Americans, which leads to lost days of work and actually lost enjoyment of life. So, how do I identify this? What can we do about it? And how do we move forward? So one of the first things, and I hammer this in all of the videos, is really being assessed properly for neck pain. The best form of imaging for a neck condition is an MRI, and that allows us to look at the soft tissue as well as the kind of structure of the bones. The curve of your neck is what's called a secondary curve. So it actually forms when we're little babies doing tummy time. That's part of why tummy time is so important. We come out of the womb in this, curled up primary curvature, and we need that tummy time to really get both the curve in our neck and our low back into proper formation. And one of the things that we see with patients with chronic neck pain is a loss of that curve. That loss of curve can be seen on an x-ray, but that will not show us the soft tissue structures involved. So actually looking at the joint surface, the ligament integrity in the area, and the muscular integrity in the area. And MRI lets us see both at the same time. Unfortunately, a lot of times your insurance carrier will require an x-ray, especially in acute cases, before they will pay out for an MRI. So that is, one of the reasons why a provider a lot of times will order an x-ray first, just to make sure that the insurance will cover what you need them to cover. You're paying them enough already, right? Beyond that, you should always be getting a thorough physical exam. A provider should have you go through ranges of motion. What's causing pain? What's making the pain feel a little bit better? And then they should start stressing the joint, right? Putting it through different compression techniques to see what's causing pain and what's causing any what we term radicular symptoms. I know radicular sounds a little bit like ridiculous, but radicular actually means symptoms going down into the extremity associated with the nerves in the area. So if we're talking about the neck, we're also going to be looking for any symptoms in the arm, symptoms of weakness, symptoms of pain, symptoms of numbness and tingling, or loss of reflexes. And that can happen usually just on one side, but it can happen on both sides if there's actual cord compression and not just nerve root compression. So we're going to, through this series, talk about the 3 top causes of neck pain that I see in my practice, how they typically present, and how we go from there. If you think this series might be helpful to someone in your life that has neck pain, or maybe there's just a pain in your neck, go ahead and make a comment, share, and like.